I believe that when the history of our times is written, the history of humankind is written, we will be seen as among the most cruel periods in human history, the total breakdown of solidarity. There are large numbers of people, first, who don't even have homes. Where will they stay during this period? How will they lock themselves down? If 10 people are sharing, say, a small one-room set, and 150 people share one toilet, how are they ever going to social distance? The Prime Minister didn't seem to be concerned about that. He said everyone should keep washing their hands. Does he not know you just have to go out every morning and see outside slums 10 rupees, 20 rupees to get these 2 or 3 pots of water? Everything they have done has shown that some lives are valuable and must be protected, and some lives, a much larger number of lives, are entirely dispensable. The government will take no responsibility for them. The migrants, finally, when they had nothing at all, they began to walk. And please remember, this is the biggest distress movement of populations in human history, except for the slaves being taken from Africa. I mean, that I calculated was larger. But it was even bigger than partition. You know, this should have shaken us to our core. And it happened because 9 out of 10 workers have no protection of any kind.
Welcome to this special event where we will have the first of many events in which the launch of this, I believe, incredibly important book will be discussed by different panels. I have the great pleasure and honor of introducing my co-panelists who will now join us in this event. Both my co-panelists are public servants who are extremely well known. The first, Mr. Keshav Desiraju, who has served as a bureaucrat in the government of India until he retired a few years ago. And perhaps his most important contributions relevant to this panel was that he was the Secretary of Health of the government of India for a number of years. It was really under Keshav's leadership that some of India's most important developments in public health, particularly in the area that I'm most passionate about, mental health, took place, such as, for example, the Mental Health Care Act. I don't believe we can see Keshav. Maybe the video isn't on, Keshav. Could you just check your video? And I'm also, at the moment we can't see you, but I hope that you can fix your video. You're not visible right now. And my other panelist, of course, is the author of this tremendously important book, Harsh Mander, who is also a public servant, who has been a public servant initially, of course, as a bureaucrat, but over the last many, many years, he has been the voice, the moral voice of our country, a human rights and peace activist without parallel, and who has chronicled this particular experience of the last 9 months of our country, that he describes it so evocatively in the opening video, which really questions the very moral heart of our nation. Today, in this panel, we're going to be really focusing on what are the lessons that we have learned in the last 9 months, both at the time of the lockdown, but also subsequently, that can illuminate some of the structural factors that affect the health and well-being of all Indians. And I want to really kickstart. I know Keshav will join us. He has a few connectivity problems right now, but he will definitely be joining us in a moment. I'd like to really start by inviting Harsh to speak a little bit about the book. Harsh, if you could maybe tell us a little bit about what moved you to write this book, to document in such great detail the events around the lockdown and what followed. What motivated you? What did you observe that really perhaps stirred you the most? And perhaps as we move on in this panel, I hope we can then discuss what these observations tell us about our society and, in particular, our health system. Harsh.
Thank you, Vikram. Thank you, Keshav, also for being here. I couldn't have asked for a better panel. Why did I write this book? It really came, when the Prime Minister was first announced the lockdown, and he was talking to us, as I said in this opening video, that we should stay at home, work from home, keep social distance, etc. I was struck by the fact that he didn't seem to be talking to the large mass of the Indian poor, who don't have homes to live in, who can't keep distance because they're packed into hovels, who can't wash their hands, and most of all, who cannot stay at home because they don't have any kind of social protection, and no one would pay them wages, and they won't be able to eat the next day if they don't work. And they didn't seem to matter. And I work with the homeless people, and I knew that even a day or two without the opportunity to work, and with the gurdwaras and dargahs and temples all closed down, they would be starving. And so I made up my mind about the second day after the lockdown that whatever happens, I'll keep out and try to provide food to as many people as we can. It was really a solidarity feeling. It was not a charity feeling. It was basically standing with people who were, and many of my young colleagues actually decided to make the same decision, and we were on the streets. And the explosion of hunger that I saw, as a district collector, I've seen moments when we had, recurring droughts for 4 years, of that kind of mass hunger in the countryside, but never in a city. I mean, literally 5,000 people, 10,000 people, 2 kilometer long lines, stampedes if anyone just heard that somebody was supplying food, and just a plop of dalia or khichdi, and people would have to wait for 3 hours, 4 hours for it. The humiliation that they felt, and very quickly it moved on from homeless people, informally, a kind of people started sharing our numbers, so we started getting distress calls. And before long, it was distress calls actually from industrial workers, for instance, in Delhi, who said they never put out their hands for food. They were oppressed. None of them were paid minimum wages, but they had, figured out their lives. Their children went to school. They ate. They paid their rents. Suddenly, everything collapsed, and they were standing in line and begging for food. People in shanties. And then people started calling us from all over the country, the river islands of Assam, the forests of Jharkhand, and so on. And it became, a massive solidarity feeding program. People contributed from all over the world. But the kind of suffering and injustice that I saw, I felt that we needed to at the same time tell the story. Because most of the media is largely celebratory and uncritical of the government. And when the middle class was asked to come onto their balconies and bang thadis, uh, again, he was talking to people who had houses with balconies. And what about the rest? And we all did that obediently. We lit candles. I felt that, we are living in a country where the middle class was feeling protected, and they didn't care what happened to the large mass of the poor. And I think that we also have, and we go on to speak about it for sure, some of the lowest public spending on health, and even the public spending that we have is not on building a primary healthcare system. Uh, and again, we in the middle class are protected with our, private healthcare insurances and, expensive hospitals. What about again the large mass of the poor? We were told that everything will be all right. Why do you worry? Public hospitals are inefficient. and with insurance you will be taken care of. 80% of India's trained doctors and nurses work for profit hospitals. They virtually contributed nothing, you know, 5-10% at the most generous, to the whole effort. It was left to the 20% in the public systems, and many of them also could not contribute because they were in other fields. The collapse, all of this, and then 9 out of 10 workers being in the informal sector, having no protection. This explosion of hunger, joblessness, the fear of this disease that had brought the whole world on its knees. A government that simply did not care. Uh, it, Many people say it was a badly implemented lockdown. No, we are not suffering what we are doing because of of the virus. We are not suffering also because of a badly implemented lockdown. It was not bad implementation. It conceptually excluded the large mass from the protections that it was offering, and that makes it, and I think for a generation, poor people will have to live with the consequences of the decisions we've taken. And it's I've said this, it's to me, the public policy decisions that were taken during this time amount to crimes against humanity. I mean, they're genocidal in their impacts. And I think I just felt I needed to say this, and that's why I would come back and keep writing this book. Ravi, my editor in Speaking Tiger, he would keep responding, and I would, So we wrote this almost like a kind of jugalbandi, and in the 6 months of the lockdown and its sort of gradual opening up, the book also came up along with all our solidarity work on the field. I think we've lost Keshav. We've lost Vikram for a bit. So, how would you respond to what I said? And
Well,
to
thank
what is happening?
thank you, Harsh. Can you hear me?
Yes, yes.
Yeah. Well, thank you very much, Harsh, for giving me this opportunity. And first of all, let me second what Vikram said, that this is an extraordinarily important book. But let me also say how sad it is that such a book had to be written. And you bring out, very clearly exactly where the fault lines are, and how badly we as a country, and I'm not talking about the government, but how we as a country and responded to that situation. Now, but having said that, let me say that we all know what happened over the last 10 months, what happened in 2020, but I do believe we really have to look to the future now. And I think the question we need to ask, and I pick up on the title of your book, is the question we need to ask is, where does India's moral center lie? Because I think if we're able to answer that question, it's not as though there's a unique moral center. There could be several. But where are these moral centers within Indian society? I think you make a very strong case that it certainly doesn't lie with the city-based middle class. Nobody would argue that it lies in Parliament. It seems fairly clear that it doesn't lie within the judiciary. But I would like to make a case for the purposes of today's discussion that I believe we should try and restore that moral center within government. And government it's very easy to badmouth government, and government does many things that are stupid, and government does many things that are sometimes even criminal. But in my belief, it is still only the government in India, and since we are talking about public health, it is still only government, to my mind, that can develop that moral center, which would then enable it to do the correct thing at the correct time. And that is something I believe we should search for. And the massive vaccination campaign that is now beginning, and to my mind, the way we should address this is we know what government did wrong during the pandemic days. We know how government lost the capacity to display its moral suitability to be doing this job. But can we learn from that? How can we remedy that during what is to come over the next several months? A really massive, massive campaign. This is public health work at its sort of best, as it were. How do we restore, and restoring a moral center within government means restoring public faith. It means restoring trust. It means government institutions and government functionaries working seriously, honorably. We're working very hard. I think those are the questions we need to be looking at as to how do we get these things to start happening if, after the very bad 2020, we are to find our way in 2021 towards restoring something of that moral center that all of us know we certainly enjoyed in this country.
So
I'd like to
sorry,
stop there.
I'm sorry, I said there was a computer crash, but I'm glad I rejoined quickly. I wanted to just follow up from Keshav, your remarks, but also Harsh's, I think, very strong and powerful words. Harsh, you used words like genocide and crimes against humanity. These are, immensely powerful words, heavily weighted with historical significance. And I think a lot of commentators have actually likened, as you have, the movement of millions and millions of workers, trudging on their feet with their babies and their meager belongings in the blistering summer heat of India, many dying along the way, and liken this to images of the partition. And I wanted to maybe, before we turn to the specific issue of the healthcare system, which in my mind is simply a symptom, the way our healthcare system operates in this fractured way, offering completely different services according to how much you can afford. I think in my mind, that's almost a symptom of a much larger poison in society today. And I wondered whether both of you can just reflect on that. And of course, that poison is the astonishing level of inequality, which of course, Harsh, you've written a lot about in your previous books. To what extent do you see all of this through the lens of inequality, that we have a government that says the things that you described, go on your back, wash your hands when people don't have access to drinking water. And Keshav, you described that the public system has historically really only catered to the poor, but right now they are the foundation of managing the pandemic. How do you see this through the prism of inequality?
So Vikram, as I've said often, I think we, as the middle class and the rich in India, have exiled the poor from our conscience and our consciousness. And that's why we were so amazed when we saw these millions of people on the streets. Where have they come from? Our whole lives, from before we open our eyes, who supplies our milk, who supplies our newspapers, who cleans our homes, who takes care of our babies, who drives us to work, and so on. We just looked so instrumentally at the working poor, but we never thought of them as people with needs and so on. Keshav spoke about trust. And there's something that Ravi Srivastava, labor economist and a dear friend, said. We talked about the breaking of labor laws, but he said something even more fundamental had happened, and that was the breaking of trust. He said that workers know that they're oppressed. They work in oppressive conditions. They know that the government has not protected them, but they had this trust that when a big calamity happens, the government will stand with us and our employers will take care of us. And I think what we demonstrated is that when the calamity hits us, we'll throw you to the wolves. We'll take care of ourselves and we won't care what happens to you. And that is what put them on the streets and all that they suffered on the trains and when they went back. The tragedy is that they are now coming back. And they're coming back with their hearts completely broken because they live in what are largely remittance economies, rural Bihar, rural UP, Chhattisgarh, MP, Rajasthan, and so on. And they have no option. There are no job opportunities. I mean, one person said, I cannot see my children starve, so I'm coming back, but I know what I'm coming back to now. I mean, even the illusion that I could, that they would take care of me, when in the worst of times, I'm coming back without that. the government has chosen this very moment to break down even the few uh, remaining protections of our labor that happened, and to dismantle even, they tried to dismantle even the 8-hour workday. Um, uh, Keshav talked about bringing back the state. I mean, when 80% of our trained health personnel work in the private systems, I think unless we nationalize, at least for the period of this epidemic, we nationalize private health services, how are we going to reach the large mass of the poor? And these are not, I have friends, for instance, in London. London has a right wing government. I was asking them about what was happening to the homeless during the lockdown, and they said that they 7-star hotels downwards, every hotel uh, was booked with homeless people, and they stayed in these hotels through the lockdown, and the bills were paid by the government. We, it also helped the hotels to keep functioning. The homeless people had a place of safety. We calculated it would have cost just 3% of GDP to actually ensure. Prabhat Patnaik and Joyati Ghosh and I wrote a couple of opinion pieces. It would have just cost 3% of the GDP to pay the equivalent of minimum wages, about 6,000 rupees to every household during the period of the lockdown, and give them universal rations. But we chose not to do that, and therefore I totally agree with Keshav that we have to search for our moral center. But a just and caring state can only exist in a just and caring society, and I think that we need people of privilege, relative privilege like us, need to examine where we have lost our way. That our prime minister can pose feeding peacocks in multiple changes of clothes at the peak of the hunger crisis in the country. I mean, something really has gone wrong, and we applaud him through all of this. I worry about, they still haven't clarified who's going to pay for those vaccines, how they're going to ensure it reaches the last person. I'll just say one more thing. I had expected to get COVID quite early because I had chosen to be out among homeless people. For the first 6 months, I didn't get it. And I was wondering what happened. And then doctors told me that you were actually among the safest populations on the planet, because these are people who have no contact with the middle class and the rich, unlike, say, our domestic workers. So they were the safest from. But after the lockdown ended, and things started opening up, I'm now finding increasing levels of infection among the homeless and among the very poor, and there's massive community transmission. There's no testing whatsoever. The government, for instance, in Delhi has a policy, and they insist on a policy of home quarantine. I said, what about people who don't have homes, or whose homes are so small that they can't quarantine? And they don't have an answer. But they still have not started testing or reaching out to the poor. My fear, Keshav and Vikram, is that the next 6 months are going to see invisible, unmourned deaths, infections and deaths of the very poor in this country now in the second round. And whether the vaccine will reach them, whether food will reach them, whether jobs will reach them, uh, uh, all of this is, I think we are really in the darkest moment in the journey of our republic. And finding that moral center is critical, but I'm not so optimistic. And I'm a person whose politics is based on very naive optimism.
So I just want to alert all viewers that there is an opportunity for you to post questions in whatever different social media form you are connected with this event. Please post your questions, and someone is going to curate them and then share them with the panelists. And I want to now hand over to Keshav.
Harsh, there really can be no disagreeing with you, and you put it very passionately. But I would again go back to say that look, we really haven't come here together to just. I mean, there is a
Yeah,
great deal to
absolutely.
go on, but we need to go beyond that. We know what is wrong, and you have put it so eloquently in your book and everything you say. This is true, and the fault lies within us. About this, there is no, I don't think we at least disagree on this. I don't think many of the people watching the show today would disagree on this. But it has to start, the recovery has to start somewhere, even if it is small. And there needs to be, I think, in the first instance, people within government who may, until now, at whatever level they are, at whatever level they are, people who have maybe until now have been scared or are apprehensive about the future or uncertain of what to do, I do believe people like that, I mean, they should get the message that there are more of them than they know. That and we're not, and here we're just talking about the freedom to do your job as you are meant to do it. We are not, this is really not anything more than that. The people who have to do their jobs are allowed to do their jobs, are allowed to report whatever is happening. For instance, it is more than likely during vaccination, especially as half the vaccination process is still clinical trials, it is more than likely that there will be adverse events following vaccination. Now, the people who know about this should be allowed to speak about it and mention it and put it down. This is very, very crucially important data. But if they are scared that reporting it is going to get them into trouble, then it's going to, in the long run, lead us into a much worse situation. So I would just like to raise this as an idea for discussion that how does one get individuals within government to recover some of their confidence and to lose some of their fear and to set about doing their job in good conscience. There may not be an easy answer. I think we have to search for that answer.
Thanks, Keshav.
Thank
You
you.
know, one of the interesting things that I've observed about the epidemic and the very different experiences of different countries. In fact, in the classes I teach undergraduate medical students, we often case studies of countries, the US, India, and Rwanda, to demonstrate how context and local factors so profoundly influence the trajectory of the epidemic. And India is a very interesting outlier from almost every other country, and that is because we have only had one wave. And it's an interesting and somewhat baffling question. Why is it that we've had one monumental wave that hit us in August or September, and after that we've seen a quite substantial and continuing decline in the number of cases, while the rest of the world in the summer was actually enjoying a respite after the first wave, and now is particularly the wealthy world has been felled by what we see going on right now in Europe and North America. The interesting observations that the studies have shown is that India actually has the highest infection rate in the world. Just last week, the Bulletin of the World Health Organization published a paper looking at all the seroprevalence studies in the world that give you a much better indicator of the proportion of the population that has been exposed to COVID-19. And even by May, 60% of Mumbai slum dwellers had already had COVID-19. And this speaks to your point, Harsh, which is that when the lockdown happened, when you trap people who have no access to space, no access to hygiene or sanitary conditions in their localities, actually you created the substrate for very rapid transmission. We don't actually know how many people really died then. Maybe only time will tell when we get mortality data out. But what we do know is that India has the highest numbers of history infections of this virus that of any country that's reported it. And I do believe that that might speak to both your observations about locking people down into these crowded slum areas, but of course also then spreading it to the rest of the country. We opened up the doors and placed these large groups of people on trains and buses to take the infection into their villages and around the country. And inadvertently, of course, what that might have led to is some form of herd immunity, which might also question really what we're going to be vaccinating for. But that's another question. I want to turn back to asking you, Harsh, about messages of hope here. I mean, we've talked a lot about inequality here, and I wanted to ask you, through all your observations in the last 9 months, I want to ask both of you, can you tell us about acts of compassion?
Yeah, I think I could heal and hold on because of extraordinary acts of individual compassion through all of this. And on the streets, every day, everywhere I went, I would find, middle class people also, like when the migrants were walking, you would have car after car packed with water pouches and food, and people would just quietly hand it out to people who were walking and would drive away. I found among the poor, even more so. I mean, I found homeless people who were taking care of other homeless people uh, within their poverty in very profound ways. I found all sorts of people reaching out, distributing food. Among my own colleagues, they took major risks with their life and with their families. And many of them never went back home for this entire period. And I would ask them, aren't you scared? Aren't you frightened by the virus? And one of my colleagues said something quite beautiful. He said that, Dar to hai, I'm frightened. I do have a fear of the virus, but their hunger is much greater than my fear, and which is why I have to be here. We run this shelter for homeless people with TB, and I was particularly worried about them. And four young men decided that they would not return home for those 3 months, 4 months, and just live there with the people with TB in the shelter and take care of them. And we ensure that not a single one of them got infected. So these are acts, and people started contributing. My colleagues around the country were able to distribute 10 million meals. It is still a drop in the ocean, but this was really possible because of kindness that still survives, of solidarity that still survives. But as a collective, I think that we we are particularly have become a very uncaring people. I think it's the long history of caste where we have a high cultural comfort with inequality, with very different lives, very different opportunities to different people. And Arundhati Roy somewhere very beautifully wrote that corona is a virus, but it's also an X-ray. It's an X-ray of the kind of society we have built. And I think that what we have built, and as I said in the video in the beginning, is a society in which some lives have to be protected. So when our ministers, our chief ministers fall sick, they check into a private hospital. They don't check into a public hospital. And these public hospitals, which are so starved of resources, is left for the poor. I also spent some time by choice when I had COVID in a public hospital. It was like, and it was one of the best public hospitals that we have. It was almost like hell. I mean, it was really, I found that, people, nobody would reach out to you. The ward boys, most of the staff were untrained because the trained staff were not willing to work. So somebody had lost a job in a hotel, so was just packed in here, was willing to work. It was chaotic. It was uncaring. People were wailing, thinking they were going to die. Nobody was even reaching out to them. My homeless brothers and sisters tell me that when they were in such public hospitals, somebody would die, there would be corpses next to them. No, the staff wouldn't be willing to pick up the corpses and say that if you have a problem, then you lift the corpses and you take it to the, to the mortuary. I think our ability to treat people of disadvantage with this degree of cruelty has been exposed to, and also the communalization. And one should not forget how, one gathering was suddenly within 1 week. How did you convince reasonable Hindus across the country that Muslims are deliberately spreading the virus by spitting on vegetables and so on? We put in jail people come to the Tablighi Jamaat for almost a year, and I had tears reading their statements. They said, we still love India, and they still recount, one jail officer who would come and give them dates because they were on Ramzan fast, and that still healed. But our ability, and Parliament was going on at that time. MLAs were being bought and sold in Madhya Pradesh. Nanded had Sikh gatherings. Tirupati had Hindu gatherings. But we talk about none of that except this one, and we communalize it. So I think that the last thing I want to say was that who took the decision to have the world's biggest lockdown? China at its peak locked down 5% of its population. We locked down 100%. Who took this decision? And there, when we look at the chief ministers were not consulted, the cabinet was not consulted. We find now there's evidence that epidemiologists, including within the government, had strongly advised against it. Who took this decision? Who's responsible for this? And why is there such an extraordinary lack of compassion? And why do we still applaud and support this? Is where my sense of despair is coming amidst the
Keshav,
individual acts of kindness.
yeah, thanks a lot, Harsh. Keshav, as a former health secretary knows better than anyone else, health is a state subject. And I wondered whether you could maybe reflect on the fact that India really is a collection of 30 different experiments of compassion or not or lack of compassion. So if we leave aside the central government, I wondered whether you can reflect on how different states, in particular some states like Kerala, which have often been spoken about as being quite remarkable in how differently they've managed the epidemic. Do you have any thoughts about what we can learn from within our own country about compassionate responses to the epidemic at the level of government?
Thank you, Vikram. I think the most important thing is state governments may not have the resources and they may not be putting a lot of their own money into healthcare, but the only sort of health armies we have on the ground belong to the states. The district hospitals and the primary health centers and the sub-centers, which are where the ANMs work, these are state government institutions. And I mentioned smallpox, polio, HIV earlier. All that was achieved. Yes, there was a Government of India direction and there were Government of India resources. But the actual work on the ground was done by hardworking, low-paid employees of the state governments. And there may have been problems, but basically they got the jobs done. Now, I think this is something we must give credit to the state governments for. They are capable of putting together, a program of this nature. Well, to look at universal immunization, the numbers are much smaller, but I don't think and all states don't do as well as equally well. But by and large, there is a decent schedule for universal immunization on the ground. Data is available. ANMs and ASHAs between them know where the babies are who need to be immunized. They know how old they are. This whole program, by the way, suffered very badly during lockdown. That's a different story. So I would think the great strength of the state governments and all, yes, some governments are better. Tamil Nadu, Kerala always come off better in these things. But all state governments have these armies, as it were, of health workers. And I believe that is where we should look. I believe those are the people who need to be strengthened. I mean, I do share Harsh's despair, but as I keep saying again and again, we need to go beyond despair. I mean, despair is important, despair is essential, but despair cannot be enough. And if we are to look beyond despair, I think we need to look at people like this. These are not fancy, high-paid people. They are not consultants sitting in Niti Aayog. There are no one of this sort. But these are the people who get jobs done on the ground. And I think state government should be encouraged to speak up, to say more about how things are happening. State government should be encouraged to put more of their own money into public health. State government should stop looking only to Government of India for budgetary support towards primary health care. State
So,
government.
Keshav, you're speaking about the frontline worker here. Just to be clear, when you say about these incredibly hardworking public servants, are you referring to people like the ASHAs?
It could be ASHAs, it could be ANMs, the auxiliary nurse midwives, it could be all the people who work in the primary health centers, the community health centers, and district hospitals. A district hospital, for instance, actually is a fine place. These are all state government employees. They have an incredible load of work, incredible load of work, because it is possibly the most easily accessible source of reasonable quality health care for an overwhelming number of people.
Yeah.
And these are the people who need support. And the best way in which they can be supported is if more money is poured into the health budgets of state governments. And this need not come only from Government of India. State governments themselves, Tamil Nadu has done this, Kerala has shown this, the capacity to raise their own resources to put into healthcare. That is where we should be looking. That is what we should be aiming at. That is what state government should be encouraged to do.
But I guess it's not just money, right, Keshav? I mean, I think you also are probably alluding to the incredible hierarchy, the power imbalance between
It
those at the
is,
front line
it is
of the.
not just money. There should be, and this is the point Harsh makes all the time, there should be a quality of care. There should be a caring government that understands why money is important and that is able to send out a message that all people, I mean, what Harsh was saying about how Muslims were stigmatized during the pandemic, I mean, that is beyond shameful. And now, why was something like that was allowed to happen in government facilities? Because clearly there was a signal that it could be done. I mean, these are the things that need to be reversed. These are the messages the state governments need to send, that all we are concerned about is quality of care.
So, Harsh, I want to just follow up on this question, the point that Keshav has raised, and you alluded to that in your account of your own experience of being in a public hospital. Throughout your remarks, you've often talked about the private sector in a way that suggests that it's actually perhaps a threat to universal health coverage in India. But in the same breath, you also describe the appalling experience you had as a very well-known Indian in one of the best hospitals run by the state. And that speaks, I think, to Keshav's point of the lack of respect and dignity that people in the public sector have. If they show this to you, you can well imagine how they treat, people who are much more voiceless. So I wondered, what is the reason for this? Why is it that our doctors and nurses in the public system treat their patients with such disdain, with such disrespect, so that it isn't even the case that people go to the private sector because they have money. They often go there because they just feel more respected by the provider. So if I can just start with the conversation about the private sector by first focusing on why the public sector actually is solely considered as a place for healthcare by even the poor of this country.
No, it's a great question, and the answer is actually can be given in a single word, which is disrespect. We work with homeless populations, and we've done formal studies apart from a lot of conversations about why they are so reluctant to go to a public hospital. And they say that they treat us with such disrespect and disdain. I mean, people will, because if you're wearing dirty clothes, they'll perhaps touch you with one finger. They'll taunt you for having a lot of children, and because of that disrespect, and most people in the middle class don't realize that a poor person who cannot take their self-respect for granted can sacrifice. They often would prefer to die on the streets than be treated that way. And that is why they much prefer to go to unqualified private practitioners rather than go into public health systems. I think that's one thing that we need to say. The second is, in fact, when Keshav was secretary, he appointed me as the chair of a group of people who were trying to advise the government about how do we make health systems work for the urban poor. And it was a great experience because I made a call, and about 30 public health people from around the country volunteered their time. We visited every corner of the country and were amazed to find that at rural areas, at least there is a sub-health center and a primary health center, which is very poorly resourced and staffed. In large parts of urban India, you don't have that, that you don't have anything at that level. And I was thinking about our report, and if during this time, if we had created the equivalent of a sub-health center for every 10,000 people, a primary health center for 50,000 people, etc., community health centers being strengthened, there would have been a whole infrastructure which would have been able to respond to the poor. Why have we not done this is the same reason as why don't we still have a common school system? Why have we invested so little in the quality of education, which in government schools, which are now accessed only by the poor? I think that consistent, why don't we have a social housing program? Why do it is because we culturally and civilizationally are comfortable with very different life value to people based on the accident of where they are born. I do think that we probably need to understand this in a civilizational legacy of caste, why India why the Indian people have. I mean, we are one of the few countries now which don't have a common school system, and where if you're poor, and we our investments in public health among the lowest in the world. So I do feel, it is, friends. Some friends attacked me after this book, saying, you're blaming Modi. I said, no, I'm not blaming Modi. I'm blaming most of all us in the middle class. And the privatization of healthcare happened not with Modi alone. It happened much earlier with Dr. Manmohan Singh, and liberalization and the pulling back of the state, and this idea that we will just buy the best education and health, everyone will have jobs and everyone will be better off. The jobs didn't occur. The public systems became, public systems for the poor became very poor public systems. And I think that, and the middle class had found their escapes to private schools, private hospitals, which compared with the best in the world. So I think it is this comfort level with inequality. Uh, uh, and that's why I end my book by talking about this as a moment of civilizational introspection. Can we use this moment? And again, I'm not talking about the state primarily. I'm talking about us in the middle class, people of relative privilege. Can we use this moment to introspect about what we have become as a people? Because when it is, Socrates said, when will injustice end? Injustice will end, he said, when people who do not suffer the injustice feel the same pain and stand with the people who suffer injustice. We don't feel that pain.
Yeah.
And
Well,
therefore, our governments are able to get away. Sorry.
yeah, no, no, sorry. Yes, I think you're absolutely right. And of course, this poses a very existential question. How do you get everybody in the other person's pain? How do you create a sense of solidarity so that someone else is suffering because you're suffering? And of course, this is an age-old question. Keshav, I wanted to maybe just touch on this issue about the private sector. Some people would say it's a straw man, you know. If it is the case that someone like Harsh Mander can go through one of the best public hospitals and treated as badly as he was, imagine what the plight is for the average poor person. And we were by poor people refuse to go to the private sector, public sector. So by blaming the private sector and saying of a healthcare is happening there, should we really be focusing our attention on strengthening the public sector instead? So that actually we have a reversal of those numbers. We have more people coming to the public sector. And I wanted to particularly ask you about your own home state, because I read that some of the reforms in Tamil Nadu have actually led to a greater number of people now using public sector than historically. What lessons can we learn from state government policy with a stronger public system?
I think what you say, Vikram, answers itself, but what you say is in direct contradiction to what is currently being said under Ayushman Bharat. Uh, what you say is absolutely correct. And all of us know from experience that a public facility that is working will be used. A primary health center where there is a functioning and halfway competent doctor, a primary school where there are 2 or 3 teachers who attend their duties regularly, a sub-center where the ANM is resident and is serious about her job. These facilities will always be used. People go to private facilities only because the existing government facility is so hopeless and there is nothing going on there. It is not as though there is a very wicked argument that is put out that because 60% of people prefer private healthcare, therefore we should support the private sector. I mean, this is nonsense. People go to private healthcare. All the data will tell you this. But they are going to private facilities and private doctors only because a comparative facility within the government is not available where they are. They would not be coming across the country to camp in Ames, Delhi. They would not be coming across the country to coming across Tamil Nadu to camp in General Hospital in Chennai if a similar facility was available where they were. So I think that is a very, very important point. Uh, it is easy for policymakers who, as Harsh says, probably belong to the same mindset as me. It's easy for policymakers to say, oh, we can't do this within government. Let us therefore engage someone else to do it. We will pay for it. But they don't realize that That's it's a very significant difference. And the point that Harsh made earlier about poor people saying that we are not treated with respect. This is a standing complaint in private hospitals. All said and done, if you went to a great public hospital like Safdarjung in Delhi, nobody will complain there that they are not being treated respect. I mean, they may not be treated, it may not be great, but no one is asking them to go away because they are poor. I mean, Safdarjung has a reputation of not turning away anyone who comes to the OPD. So I think there is this to be said, and clearly the answer is more and putting more government money into strengthening existing institutions and encouraging people to go back to them. If it's not a primary health center, you're not asking for much. You're asking for a functioning MBBS doctor. You're asking for 2 or 3 nurses. You're asking for all the medicines on the essential list of medicines to be available. And maybe you want one ward boy kind of person. That's what you're asking for. If dawai is available, people will come. The reason they don't come is they're not getting even this minimal level of treatment.
Harsh, you mentioned something which might, actually provoke a lot of, questions. I think from the private sector. You used the word nationalizing the private sector earlier in your remarks, and I wanted to just hear a little bit from you. I think we're all agreed that strengthening the public sector is, in and of itself, a fundamental goal to build a strong healthcare system in our country. There can be no question about that. The three of us, at least, are exactly in the same place on that. I think the question really still remains that if 3/4 of all our resources, if we count resources in a very crude way, in a very narrow way, as the number of doctors, specialists, etc., are in the private sector, what do we do with this private sector? And you use the word nationalization, and that has a lot of historical stuff attached to that. What do you mean by that? And can you envisage a system in which these two can coexist with mutual respect within a national umbrella of universal health coverage? And if so, what would that look like? And Keshav, I'm going to follow up with you as well, to address that question.
As long as if we want to have a for-profit healthcare system and a for-profit education system, I think it can coexist only if you have a agreed floor of human dignity below which no one will be allowed to fall. Yes. So, without paying money, I should get decent healthcare. If I want very fancy healthcare, I want a darban to open my door when I go into the hospital, I'll go and pay some money. But I should be able to get decent healthcare with respect from the public system. I think that we haven't done that, and that makes it culpable. It makes it culpable when 80% people are working for profit, even during a pandemic of this kind. I mean, the stories that we encountered about, people, the test would cost 200 or 300 rupees, they would be charging 2,000, 3,000. That was one case in which the Supreme Court actually intervened and then backed off, trying to set the rate at which tests will be charged for. People were, they set a certain ceiling on how much they could charge, and then they would say PPE sets cost so much and something else costs so much. So there has been massive profiteering even during the pandemic, and I think it is completely unconscionable that people use this as an opportunity, that for profit, and it, I'm come from the left, but I don't have this kind of hostility to the private sector, except when it, we've forgotten that you become a doctor primarily to heal the sick, and that is your primary duty. You don't become a doctor to make millions of rupees by extorting people who are desperate at that time. I think that we need to reclaim the core of what the health the health system is supposed to deliver. That law is a profession to deliver justice, not to prevent people from to protect people who are rich and powerful and breaking the law. So we need to reclaim the idea of decent public services for all people without cost. Then over and above that, you want to have a for-profit system. I can live with it. But my problem is that the choice is actually the for-profit system, which is extortionist in what it is doing, and a completely broken public system. And where does, as a child, I'm the son of an IAS officer. I remember in my entire childhood, we used to only go to government dispensaries, and I used to sit outside on a bench with my domestic helper and other people. Everyone used to wait for their turn and see a doctor. Where did that all go? So I think that we need to ensure, as I said, a floor below which all public services, universal public services, healthcare, education, transport, housing, and then let people do their fancy stuff over and above that.
Keshav?
Yeah, Vikram, three things. The first thing is absolutely what Harsh said. You need to have a decent public system, and then you can also have a separate private system. But the only justification for that is if there is a decent public system. Secondly, nationalization of private facilities. I don't think even Harsh in the book was recommending that as a permanent measure. It was an emergency measure. So during the worst of it, when people were moving, in order to prevent people from moving, in order to contain the epidemic, that is when a measure like that should have been considered. It was not. I think that's a fair point. Thirdly, when we say private, we always only immediately think of massive city-based private hospital chains. Private covers a huge range of services. Somebody in some village, just a board saying doctor, MBBS, this is also private. But they may charge a small amount, but they are there. In many villages, and certainly in North India, where there is a non-functioning primary health center, there probably is an MBBS doctor sitting there. And now this is also private. And we have never really learned how to use these facilities, how to bring these people into the healthcare system, because the great advantage they bring is that they are physically present in some of your most difficult locations. And the last thing, let us also not forget, some great private institutions have played a huge public function. I mean, Dr. Shanta of the Cancer Institute passed away yesterday. The Cancer Institute is private, but it plays a more public role than many institutions I can think about. So we must be this whole issue of the private sector and healthcare needs to be discussed threadbare, but we must distinguish between the various kinds of private care that exist.
Keshav, thank you for pointing that out. I think both of you have really pointed out that, even these broad buckets of public and private actually capture very, very diverse kinds of experiences, from the Safdarjung hospital in the public sector to the much less well-off, primary health center. And similarly, there are incredible examples of private for public good, which happens. So we shouldn't really pretend it's all the same. But I think the issue that, and we only have a few more minutes left, and I want to make sure I give enough time for both of you to say any closing remarks that you might have for our audience and for yourself, really. What is the lesson you take away from this pandemic? And if we can focus for now on health, because that's the subject of this panel, what is the lesson you take away from this pandemic that you believe our country needs to embrace to create a better society, and above all, a path towards universal health coverage, which I think we all agree is really something we need to attain. But I think, unfortunately, we lost Keshav now, but I'm sure he'll rejoin. But I think the question you raise, Harsh, is that about profiteering. It's not so much about the private sector, but it's about profiteering, which I think you are rightly pointing out is the real evil here. And it is this kind of profiteering which accounts for the fact that today medical bills are accounted as probably the single leading cause of falling into poverty. Keshav was just saying that medical bills are now the leading cause of falling into poverty in our country. So it's not the private sector which is the problem, but the profiteering that happens in some parts of the private sector. Let's be clear that we are not assuming that they're the same. There's an overlap, but they're different. And I believe a lot of my colleagues in the private sector would be equally aghast when they see the kinds of irrational, unaccountable services that some others in the private sector might deliver. So in closing, I'd really like to go back to my question to each of you. What do you see as a vision for our country that we can really build on the perhaps some would say the embers of what has been a really terrible pandemic experience. Others would, of course, have a very different opinion. We've done really well. We only had one wave and very low deaths, etc. And there'll be, I'm sure, many postmortems about exactly what happened and how do we read what happened. But for now, what do you think is the most important lesson for the future of our health system? Harsh, let me start with you, then Keshav.
Yeah. Yeah, I'd be happy to argue it, but I really would request Vikram also to give your vision. I think that this is really a very, very important question. Pandemics have always, been a moment where things come to light, where you see very starkly. I was reading reports of the plague epidemic in 1894 or something in Bombay, and colonial administrators actually wrote that the two things that could have saved lives, most of the poor, come completely free, which is clean air and clean water. And can we build this city in a way that the poor have access to clean air and clean water? And then we forgot about it as we went along. I think that, if we can make sure, the point of writing this book, the point of these conversations, can we make sure that we don't allow people of privilege and then our governments to forget what happened? I mean, that we don't even have a system of registration that works for urban migrants. We don't even have their numbers. When Prabhat Patnaik, I was discussing and was saying that suppose the government decided to give everybody 6,000 rupees a month, how would we operationalize it? In rural areas, you have NREJs, so you have a list of workers. In urban areas, you don't have a list. And actually, Prabhat said that the only thing we probably could do is something like an election where we'll say this month, this month is this finger, and people just line up and you give them the cash and they go. I mean, we don't have, when the government is not even, doesn't even have a register of its workers, what kind of protection is it going to give? So I think that elementary, basic protection of labor, that's a subject of another discussion, and healthcare for all, public health systems, primary healthcare strengthened hugely, decent, well qualified people moving in, and I think even compulsory public service by anyone who is who has studied medicine on public funds. I would I think the strength of universal social rights basically is something that I hope we don't lose sight of when we rebuild. Can we build back better, or are we going to build back an even more unequal society, which is to which the workers will still come back to because they don't have an option? Is that the society that we want to build? Uh, and lastly, I saw in the chats one question: what can I do as an individual with the kind of society that we have built? And I really, there are many ethical systems that answer it, but there's something that Prophet Muhammad said actually, which I think answers this most beautifully. He said that what is your duty when you witness injustice and suffering? And he said, at the very least, respond from the heart. At least feel badly about it. The better among us will respond from the tongue, which will speak out against it. The best among us, which will be a smaller number, will respond with our hands. We'll act against it. My problem with my country is that people of relative privilege in this country are not even responding with their heart, not feeling that pain. If enough of us, if we just restore kindness in our society, other things will follow. Justice will follow. The state will have to listen to us. It is this absence that we're not even responding from the heart, let alone from the tongue and our hands. That I think, each individual has to take responsibility.
Keshav?
Thank you, Vikram. No, I mean, there's no disagreeing with Harsh, and I'm not as eloquent as he is. But what have we learned? What should we take away from our experiences? Government needs to put more money. That is when people will follow. If there is huge government investment, obviously the minds of government servants will follow that money, will ensure the money is spent. That is how attention will be called to some of these very, very crucial areas. That's what I would like to see happen. Thanks.
Keshav and Harsh, and maybe I'll just give my remarks. Harsh, I believe that the key word in universal health coverage is the first word, universal. For me, this is not just all health concerns. It's not just about ensuring that the healthcare system addresses prevention through long-term care. And let's not forget that long-term care is becoming an increasingly important cause of impoverishment. Our system is almost completely unprepared for long-term care, particularly of older people. that it involves all practitioners in our country. I believe that both the private and public sector have a role to play in universal health coverage. And importantly, perhaps the most important view is that it is universal in terms of all people. All people in this country enjoy the same quality of care, regardless of their class or community. Now, I just want to end by saying something that, how do we achieve this? So, we've assembled a citizens commission on behalf of the prestigious journal called The Lancet, which is seeking to sort of really plan out a roadmap to achieve this goal in the space of the next 10 years. But I think I wanted to emphasize why this is an important initiative. And it is important because it's not experts sitting in a room who are figuring out how to do this. But in fact, our goal is to actively seek the opinion, the aspirations of people whose voices have rarely been heard. This is the actors in the healthcare system, ASHAs, ANMs, primary care doctors, and private doctors, and the citizenry of this country. And ultimately, we hope that to realize universal health coverage is not a technical thing alone. I think you've both spoken to this. What we need is a social movement to demand a universal health coverage system for all Indians and to hold the state accountable to realize this. With that, I wanted to just thank you both for this incredibly engaging conversation and to thank the organizers for having set this up. I know that there will be now a short video that will close this event, but I also wanted to alert all the viewers that there will be more panels that will be organized really around different themes related to Harsh's book. But for now, thank you all for joining, and please do stay on to watch the last short video on this book. Thank you, Harsh.
Thank you.
घर में रहने से हम लोगों का काम काज तो है नहीं, हमें कहते घर में रहिए, हम क्या घर में रह के दीवारें तोड़ के खाएंगे?
When students were stranded in Kota and the government organized those beautiful buses and took them home, I keep thinking, I wish I lived in a country where maybe one student would say, I refuse to get onto this bus. I refuse to be taken home in this way until you do the same for all the migrants. But we didn't have one student who did that.
नहीं तो पैदल ही जाएंगे फिर घर. पैसे नहीं.